Let's talk about hand expression. Hello, my name is Dr. Arlene Dubier. I am a naturopathic doctor and birth doula at your Downtown Doula. Today we're going to be talking about the benefits of hand expression or breast and nipple stimulation to help with labor preparation as well as help with milk supply postpartum. So what is hand expression? Why do we do it? Why do we do nipple stimulation? Nipple stimulation itself can actually cause the release of oxytocin from the brain. Oxytocin is the main player in labor. It is the hormone that helps your uterus contract. So there is a thought that doing prenatal nipple stimulation or hand expression can prepare your body for labor. The research does show that in order to actually induce labor, you do have to do quite a bit of hand expression. In some of these studies, people were using breast pumps, and for the majority of the studies, it was about 45 minutes to an hour a day for several days in a row, in which they did this hand expression or pumping in order to induce a spontaneous labor. So in the people that did that, about 37% of folks who stimulated their nipples went into spontaneous labor compared to 6% of those that did not. The caveat to this, however, is that the cervix needed to be ripe or soft in order for this method to work. So if you are planning on doing hand expression or nipple stimulation in order to induce labor, we definitely suggest that you speak with your healthcare practitioner about how to do that and if it is right for you. Now, the other benefit of doing hand expression prenatally is that it does help to bring in your milk supply postpartum, and we find that it does increase parents' confidence with hand expression and expressing colostrum for their baby. So this is definitely something that we would suggest you do, even if it's just 5 minutes a day on each side, starting from week 37. So how do we do hand expression? So what you'll need is, of course, a clean set of hands. What you're going to do is you're going to use your fingers and your thumb to create a C shape. I generally find that I will use these two fingers and my thumb. What you're going to do is start about 2 inches back from the nipple. I'm going to hold it this way so you can see the direction that I'm going in. And you're going to press back towards the chest wall, compress down, and you kind of roll your fingers forward a little bit, okay? And you can always change position. So starting 2 inches back from the nipple, you're gonna press back into the chest wall, compress so that your fingers are coming closer together, and roll forwards a little bit like so. Eventually you might find that you'll get into a rhythm of this where you can just press back, compress down, and just keep compressing down to express. This is more so when your mature milk comes in. With colostrum, it is usually a little bit thicker, so using your hand is better than using a pump because sometimes the pump might not be able to adequately express it. So again, you're gonna press back towards your chest wall. You're gonna compress so that your fingers are coming closer together and roll forwards gently. I also usually tell people that even though you're hand expressing prenatally, there is a chance that you might not see some colostrum until your baby's actually born. So if you don't see any droplets, don't panic. It's very common for that to happen. And if you do see some drops and you're able to collect it, that's great. You can always collect it in a little sterile medicine cup, or you can purchase some 1 milliliter syringes and collect it that way and store it in the freezer for use when your baby is born. If you have any questions about how to do this, feel free to leave a comment down below or contact our team. Happy hand expressing!